Welcome to the webinar. We are going to be talking today about AB2246, a piece of legislation that needs no introduction in California, and developing your suicide prevention policy, what school leaders should know. And I know that we have quite a few school leaders on the phone to hear from Rich Lieberman, and who I would love to welcome. In a moment, I wanted to do a little bit of housekeeping first. Please know that this presentation will be recorded, and a copy of that recording will be sent to you after the presentation. You as attendees, and thank you for coming. I know this is a bite out of your day, and we really appreciate having you. You are in listen-only mode, but you can ask us questions, which we will pose to Rich. And the way you do that is through the question dialog box on the right-hand side of your screen. So if you want to give that a little bit of exercise and check that out, try that out, please type in and say hi, where you're visiting from today, and tell me on a scale of 1 to 5, with 5 as the highest, where your district or school is in regard to its suicide prevention policies and procedures. So 1 being you haven't started even to think about it, and 5 being you guys are ready to go on the first day of school in fall of 2017. So again, thanks for coming. Please submit some questions, and if you're a social media person, connect with us on Twitter. Thanks. I'm Jennifer Spiegler. That's me. I'm the Senior Vice President of Strategic Partnerships here at Cognito. I work with a lot of our K-12 programs, and would love to hear from you about whether or not you have had experience in using any of Cognito simulations. For those of you who don't know Cognito, I will just say we're the folks who believe that conversations change lives. We are a company that develops and delivers online role-play simulations. We have a portfolio of 8 of those simulations for K-12 professional learning and curriculum. A lot of folks in California have had experience using these, and if you haven't, please let us know, and we will make sure that you do. Our simulations allow you to practice conversations, to build skills, increase self-confidence, and take action, including with suicide prevention and mental health. And they've been used by over 300,000 educators in 11,000 schools across the country, many in California. The flagship program in this series, which is called At Risk, is listed on the National Registry of Evidence-Based Programs and Practices. So let me now, with no further ado, hand this over to Rich Lieberman, lecturer in the Graduate School of Education, Loyola Marymount University, but many of you in California will know Rich for his work in suicide prevention with the LA County Office of Education. And we are delighted to have Rich here to talk with you today. So Rich, it's all yours. Thank you very, very much for joining us.
Thank you, Jennifer. Thank you for the kind words. And I want to thank Cognito for the opportunity to examine this landmark suicide prevention bill and the model policy that was provided as a guideline by the California Department of Education. I also want to welcome everyone tuning in today, the administrators, school-employed mental health professionals, community mental health agencies, parents. You're all the critical suicide prevention advocates in your community and schools. So I thank you very much for getting involved today. So let's take a look first at AB 2246. It was authored by Assembly Member Patrick O'Donnell and the sponsors. So we want to give a shout out to the Assembly Member O'Donnell and Equality of California and the Trevor Project. It was approved by Governor Brown last September, only 8 months ago. And it was California's response to the rising suicide rates since 2007. Suicide is now, sadly, the second leading cause of death for 10 to 24-year-olds in the United States. It's important to note that suicide prevention works here in California. Tremendous effort with our suicide prevention strategies. California is number 44 out of 50 states in our overall suicide rate, number 45 for youth. However, it's also important to note that we're number 1 in overall numbers of those that die by suicide. And sadly, almost 1 in 10 deaths by suicide that occur in the United States occur here in California. Moving on, this bill mandates a policy to be implemented by all LEAs serving 7 to 12. So I think a weakness is that the mandate does not apply to private schools or students below grade 7. And I really think this should be seen as a mandate for all K-12 schools. Yes, suicide below the age of 10 is very, very rare, but it does occur. A recent study from 1993 to 2013 looked at the suicide rate and suicide deaths of 5 to 11-year-olds in America and found the rate of African American students to be twice that of white and Hispanic students. And while working for the Suicide Prevention Unit of Los Angeles Unified School District for 25 years, we took 20,000 calls to the hotline, and 1/2 came from elementary schools. So please, while the mandate doesn't apply to private schools or students below grade 7, we're encouraging all districts to consider adopting a suicide prevention policy as a safety net for all your students. I have waited all 30 years to see that word shall in a law, as in you shall adopt a policy, and here before school starts, so their example date is July 1, which gives you guys a whole 8 days. However, please do not rush this. I'm going to go through the model policy and give you some initial steps to start if you're starting from the beginning. It's important that this policy be developed in consultation with all your community stakeholders. And very important part of the process, very important, are school-employed mental health professionals. You'll see, you hear me use that term, but it refers to your school psychologist, your school social worker, and your school counselors. And what makes this law particularly strong is you must address all the components: prevention, intervention, and postvention guidelines and procedures. What's interesting is that the previous legislation focus in the United States, for those states that have laws on the book, much like the Jason Flatt Act, these laws focus on teacher training, and teacher training is one small component of a comprehensive suicide prevention program. So this policy must be adopted at a regular meeting of your school board. Moving on, the policy must address some high-risk groups. Kind of happy to see at the very top of these groups are youth bereaved or exposed to suicide. The American Association of Suicidology estimates for every death by suicide, as many as 147 people are exposed, and as many, somewhere between 6 to 18 will have their lives changed forever. We see youth with disabilities, mental illness, and substance abuse. Yes, depression and substance abuse are powerful risk factors for youth suicide, but we are seeing more comorbidity in young people today, and particularly for young girls, comorbidity. This is 2 risk factors working together. And when they work together, it's kind of synergistic. which means it's greater than the sum of the parts. So for young girls, it's depression and alcohol and substance abuse. And for young boys, it is comorbidity of depression and conduct disorder. We see lesbian, gay, bisexual, transgender, or questioning youth. I'm often asked if being gay is a risk factor for suicide, and I'm not convinced. Right here in California, the groundbreaking work by the Family Acceptance Project and Caitlin Ryan did research, and they found when gay kids grow in nurturing homes and safe environments and supportive environments, they have no greater suicide risk than their heterosexual peers. The factors that bring gay kids to a high level of risk are parental rejection and peer victimization. We see also there is mention of training of staff awareness, and I'm going to go into that a lot more as we go along. Moving on, this policy actually must state that everybody plays a role in suicide prevention, but that role must be done within the scope of your credential and your license. For example, simply, 3 things we never say to a teacher is, well, she said it to you, so you have to assess her for risk. She said it to you, so you have to call her parent. She said it to you, you have to fill out documentation forms. We want everyone operating within the scope of their credential, and this emphasizes the incredible value of your school psychologists, your counselors, and your social workers who have the training to assess risk, notify parents, provide interventions for low, moderate, or high-risk kids. And these are the folks you turn to when you need guidance in the immediate aftermath of a death by suicide that impacts your campus. Next slide. The bill has kind of a sense of humor. Here it talks about reimbursement for all costs of implementing the policy. Okay, good luck with that. The bottom line is we are all doing this because it is the right thing to do. The policy and procedures must be clearly defined for students and parents and staff and all the community stakeholders, easily accessible. So we're going to talk about a hot hint of moving a lot of these resources onto your district's web page. Clearly, that districts that have policies and procedures in place will help to avoid legal liabilities. And there are some case discussions and articles listed in the slide. Basically, quickly, schools have been sued and held liable for a couple of things. One was not notifying parents or protective services in a timely fashion, and providing inadequate supervision of a student that was identified at risk. In other words, somewhere between the referral and the assessment for suicide, the student is lost. And this sometimes happens if a teacher might hand a student a troublesome journal and say, please take this up to your school psychologist or counselor to talk about. It is very important. We'll talk about how teachers must begin and maintain the chain of supervision. So let's move on to the policy. A big thank you goes out to Monica Nepomuceno and her committee. The extraordinary hard work over the last 8 months in putting this together. Considering that California has very strong and vocal suicide prevention advocates, it really was an incredible job. So a big shout out to Monica. This is a comprehensive suicide prevention policy. And let's keep in mind that school districts are having a number of these policies from various channels come through. I am here to recommend the model policy by the California State Department of Education because I know the people that were around that table are very passionate about suicide prevention. I kind of honestly think that many districts are out in front of this already. Many have intervention policies and procedures in place on the books, and they need just a little fine-tuning as far as prevention and postvention. The example of policy statements: superintendent shall develop strategies for prevention, intervention, and postvention, and this includes professional development of all school personnel in all job categories. I like this. You have no idea how important, well, you do, you're educators, how important the cafeteria folks are, the substitutes, your bus and transportation folks, and of course a program very close to my heart, the after-school programs, and how important they are to be included in this process. To assure the implementation, the district shall designate a point person. Okay, the strategic planning should involve your school-employed mental health professionals, law enforcement, local mental health agencies and organization. This is, my first hot hint would be to create a suicide prevention task force where you can bring these people around the table to either start the process or modify your process. A task force which is filled with people from the school, everybody, what brings all of these people together is suicide prevention. And this task force can deal with issues such as developing the policy, and it can deal with prevention training, particularly for staff, prevention issues, staff and parents. Each school would appoint a staff liaison to this task force, and I would see that as a crisis arm of your task force. This is a perfect role for your school-employed mental health professionals. These are the individuals that have to focus on intervention and collaborating with your community agencies and law enforcements in order to continue to supervise and modify high-risk kids and to follow through on the process. Let's begin with the prevention component, and I'm going to talk about each of these: safe messaging, training components, specialized training for your crisis team, training of staff, and training for parents. But at this point, I just want to make one comment about training for students. Let me tell you what my fear is. My fear is that some districts may seek to kind of check this one off by putting all the kids in an assembly. Okay, write this down. Hot hint, don't do that. Okay, we do not do suicide prevention in assemblies. It must be done in smaller groups, infused into the curriculum with developmentally and culturally appropriate materials that teach coping and help-seeking behaviors, in addition to what to look for and what to do. So training students requires planning, and I think it can be very helpful through the work of a school task force to guide you. All students should be encouraged not to keep any secrets and to tell a trusted adult. So you want kids to ID those trusted adults on the campus who they can turn to. I do suggest you can do some targeted student groups, peer counseling, your gay-straight alliance, I said peer counseling, your student government, your psychology classes where kids, have volunteered to be advocates for their peers. Moving on, let's take a look at safe messaging. Safe messaging is at the forefront of the national suicide prevention movement. Essentially, it's how we talk about suicide. We know through the literature and research that unsafe messaging can lead to contagion. Messages that sensationalize or romanticize or glamorize suicide, that provide details or simplify a very complex behavior. In other words, shows like 13 Reasons Why in terms of the messaging can lead to contagion. We've been working with media over the years to try and come away from using the term committed suicide, which is not very compassionate for suicide survivors. It's not very comforting. And to replace that with died by suicide. Safe messages are for folks like all of us that are tuning in today who go out there to train others. It helps us to emphasize hope. Suicide is preventable. There are evidence-based treatments for all the risk factors. Everybody plays a role in suicide prevention, and kids are resilient, and recovery is possible. In the aftermath of suicide, when people are most vulnerable and struggle to get answers to very difficult questions, sometimes the media needs to tie things up pretty nicely with a narrative, like he was bullied, she was gay, they did drugs. This safe message can be very comforting to survivors. Suicide and the grief that follows a death by suicide are very complex, and no one person, no one thing is ever to blame. We have some excellent resources for safe messaging. My hot hint here is that this is mandatory for your public information officers to review when working with the media and when approving communications that come out of the district office. My second hot hint for public information officers is you need to get yourself a social media manager, someone to help the district navigate through that incredible world of social media. I think social media has played a role in fueling contagion in America, and we need people that know how to navigate to assist train staff, advise administrators, train parents in how to deal with social media. These are wonderful resources. Let's take a look at the policy for staff training. I love it. All staff shall receive training in the risk factors and warning signs, and this must be done annually. For the LACO program that the Center for Distance and Online Learning and I helped develop for LACO, we offered training for parents and for staff, and that's generally done in staff attention span time, which is about 1 hour. These should be offered by school-employed mental health professionals, once again, your school psychologist, social worker, or counselor, and they should be revised every year as emerging best practices are revealed. Here are some of the core components for that staff training. So you see, it can't really be achieved in a 15 or 20-minute presentation on the agenda for a staff meeting when other things are being discussed. Common myths need to be dispelled. Things like talking about suicide puts ideas in kids' head. Most kids don't show warning signs when we know they do. We also know talking about it relieves anxiety in kids and doesn't put ideas in their head. A myth like suicide in elementary school doesn't exist. Actually, it does, and those kids do reflect a lot of these kinds of behaviors that are troublesome. And elementary schools have less resources available. They may have their school psychologist every other Tuesday and share an office with the nurse, the counselor, and the social worker as well. Another component is protective factors. I like to stress the protective factors associated with school, like how important connectedness is at school, that safety and security is at school. Many schools now are going to later times, like instead of the 7 o'clock class, having kids come in, because sleeplessness is a growing risk factor for youth today. Kids are checking their likes on Facebook or wherever they are, Instagram and Snapbook, or anyway, they're checking their likes at 3 o'clock and they're getting up at 5 in order to do AE classes. Much too much stress. We need to know risk factors and warning signs, who are at high risk, and how to refer these kids. I also stress with teachers to join the crisis team when evaluating the individual student. I think the teachers at times know these kids the best. When a teacher would say to me on the hotline, this behavior is not like this child at all, that would jump out at me as a hotline operator. Teachers also need to know how important their role is after a suicide occurs. The most important factors are emphasizing immediate referral and supervision. Here we have training for specialized staff. This is crisis team training for your school employed mental health professional in risk assessment. School employed mental health personnel is starting to use more sophisticated assessment tools such as the Columbia Suicide Severity Rating Scale, and have participated in these AMSR trainings of assessing and managing suicide risk. Many of the resources we're going to talk about are accessed through your Department of Mental Health. Let's take a look at policies involving the parents. Parents need to be included in all suicide prevention efforts. Procedures need to be shared. One of my hot hints is to make the resources, such as the policies, easily accessible on district pages. And the policies, the resources should not only post the policies, but if I'm a parent and I type in depression or trauma or suicide, materials should come up that give me some guidance. There are critical members of all school crisis teams is a parent liaison. Okay, so let's take a look at the components of parent training. Remember, I think this fits into about an hour to an hour and 20 minutes, which is about how long you can have a parent on a school night. We emphasize strategies like don't be afraid to talk to your child, know the risk factors and warning signs, and if you are concerned, respond immediately and turn to the school for guidance. Here are some recommended prevention resources that accompany the model policy. We see the ASSIST training for school employed mental health professionals. I'm hoping that Jennifer can come back, tell us more about the wonderful materials at Cognito, these online interactive modules, extraordinary resource in today's world. We have QPR, which is an example of gatekeeper training, which the basis of which is question, persuade, and refer. Let's take a look at Safe Talk, which is a half-day alertness training that prepares kids over the age of 15 as gatekeepers. Safe Talk, where talk means tell, ask, listen, and keep safe. Also, the youth mental health, excuse me, youth mental health first aid, which teaches an awful lot about recognizing the signs of mental illness and connecting people with the appropriate resources. One program that is not mentioned, but I believe deserves a shout out, is the Signs of Suicide Depression Screening Program, SOS, one of the only evidence-based depression screening programs out there. It's a depression screen, as well as a gatekeeper video to raise awareness in kids. Their acronym is ACT, Acknowledge, Care, and Tell. I would exert a word of caution here to be careful when implementing a depression screening program. You must have the be careful to have the scaffolding in place before you identify kids that are depressed. Be careful what you ask for. As many as 10% of kids on any given day can meet the criteria for depression. Let's look at the intervention component. I think we're doing pretty good on time. The model talks a lot about collaboration and supervision. And over the years when I have trained, I always kind of use the phrase, collaboration is your liability insurance. You are all members of the crisis team acting in what you believe is the very best interests of your student. You need to designate suicide prevention liaisons on staff. So every school has to have a liaison designated, and I would say that needs to be shared between two people, that teachers know who are the folks they can bring their concerns to. My hot hint is that these need to be permanently based school personnel, or if they share the position that someone needs to be at school every day. That will be a critical link between a teacher, a student, and the student's family and resources. It does clarify the process for assessing a student and then notifying the parent. I remember a number of cases where parents came to me and said, when my child first mentioned suicide, you should have called me and you never should have talked to her without me present. And indeed, when a student is in crisis, we are certainly within the realm of the laws to ask questions to help that child. Certainly, if we were to determine that calling the parent would place the child in a more dangerous situation, we're not going to do that. We're going to notify protective services. So it does spell out how districts can provide resources to parents, and then if parents do not follow through, how districts can collaborate with parents on encouraging them to follow through, or feeling that if the parent continues in this vein, they are neglecting the needs of their child. So I like the way the policy spells that out. We move on to action plans for in and out of school attempts. The intervention component must have interventions for low and moderate to high risk kids. Remember, the research says there are no predictors of youth suicide. It's kind of a number of, as many as 7 different risk factors coming together in a perfect storm. So if we don't have predictors of suicide attempts, then we must be vigilant, even with low-risk kids, to supervise and follow through. 2 critical areas are kids returning from hospitalization, so schools need to develop re-entry planning and safety planning for their students. Let's take a look finally at some guidelines for postvention. And right now, my hot hint is that following this small section, I'm going to show you 3 toolkits that are out there for your help. After a Suicide Toolkit for Schools is the seminal resource for how to proceed in the aftermath of a death by suicide. So my hot hint, download it now. It is currently being revised. I'm contributing, working working with AFSP, our American Foundation for Suicide Prevention, wonderful resources, and the Suicide Prevention Resource Center on that revision. It talks about how to gather information, triaging staff, reaching out to the family, and how to communicate. One of the most valuable resources in the toolkit are different letters. Letters when you have the parent's permission to deal with the death, if it was verified as a death by suicide, to deal with it honestly and in your communications. There is a letter for when you do not know if the death was accidental or intentional. And finally, there are templates for when parents do not wish the district to talk at all about it and to respect their privacy. Those are very difficult letters to write, very difficult to think in times of crisis. So having this done, having the manual, very helpful toolkit for you. Triage and screening of students and how we cope with contagion. Actually, a triage method that based on triage for ER in terms of finding kids that were exposed either proximately by being close to where the suicide occurred or emotionally being friends or connected with the individual. We want to be able to identify all kids that become at risk and holding all staff meetings, providing guidelines for what needs to be discussed at that meeting. Also, the difficult, dealing with the difficult situation of memorials. Right now, my hot hint is before the school district starts, one thing that you must do is establish a model policy acknowledging of how the district is going to acknowledge all student deaths. So you no longer have to worry about precedents of, well, we established a foundation here, we planted a tree here, we dedicated pages in yearbooks here. From now on, we're going to adhere to a model policy on memorials. It includes how to deal with spontaneous memorials that build on school campus that need to be treated with respect. But right now, you should have a policy that really acknowledges all deaths in the school community. And social media. I think that this is the critical issue on the threshold of crisis response for schools. It's a whole topic on its own. I just want to repeat, you need to look into appointing a social media manager that can help you navigate and provide training. Let's take a look at those three critical toolkits. We see the toolkit for mental health promotion and suicide prevention, which comes out of Palo Alto, a community that has struggled in the past with clusters of student deaths by suicide, and their advocacy and their response to the cluster has just been extraordinary with Project Safety Net. Coming out of that is the toolkit, as well as the toolkits for preventing suicide from SAMHSA and the After a Suicide toolkit from for schools. I think these are all critical to be consulted during the process of developing your policies. Let's take a look at some state resources. Towns with hotlines have lower suicide rates than towns that don't have hotlines. So here we have the National Suicide Hotline. And kids sometimes can be reluctant. So we have the crisis text line, as well as the Trevor LGBT crisis hotline. We have the services here in California of Teen Line at 310-855-HOPE. And they also have a crisis text line. You can see all the resources from the California Department of Education. Their suicide prevention resources are all on the page that's listed there. And two strong advocates in California, the American Foundation for Suicide Prevention. I'm telling you that all of the legislation that has come in suicide prevention has truly been through the strong advocacy of survivors. We also have the National Alliance on Mental Illness that provides all kinds of services for youth and for schools as well. Here are some of the national resources and websites, and I think I'm right on time to kind of hand over the reins to Jennifer again for questions and answers. Once again, thank you very much for tuning in today.
Thank you, Rich. Wow, you're a pro, right on time. Thank you so much. And all those hot hints, I think, are really, really useful. We do have questions, and now is the time, if you're out there in webinar land, if you want to ask questions. I do have a number of questions that were asked during the session and ahead of time, so I'm going to let Rich address those while you're asking more. One is, and this is hard because the model policy from CDE is so comprehensive. The first question is, what are the minimal critical components of suicide prevention that meet the requirements of the law? And I interpret that to mean, do you think this very, very comprehensive, for districts that really feel that they can't meet this comprehensive requirement, what do you think are the minimal critical requirements?
Well, for those that don't have any policies and procedures in place, I would, over the summer, put together your task force. I think that this is something that's not to be rushed and something that's not to be shortcut, because the law does state it's got to have prevention, intervention, and postvention components. So, and the model policy, the first 10 pages kind of goes after prevention. So you can see that's kind of the value is, let's get the scaffolding in place. So if you can show that you're moving towards developing a comprehensive policy, there's no way around it. You're going to have to, the prevention component is going to involve training. That training is going to have to be done annually. And the policy has to be, the law states you guys got to get out there and collaborate with your community agencies, even if it's one person out in the community, the one mental health agency that services you. They obviously, you know them, everybody knows that person well that's on this. So I think if you want to focus on prevention, getting the task force together, don't run out and train teachers if you don't have an intervention component in place, because you're putting the cart before the horse. You're going to train teachers in what they do, but your intervention component hasn't been developed yet. So you need to get your intervention component down and then train your teacher.
That's a great point, and you've just answered a lot of the questions that are coming in around timeline. So I think what you're saying is put together the task force. You can do this incrementally. This has to be rolled out during this school year, but take the time to do it right.
Absolutely. That's what I said. Please don't rush this.
Yeah.
Like, don't put kids in an assembly. All right. Don't rush.
Right.
Take, be guided by your task force.
Yes, and those of you who are asking about the slides, yes, the slides and the recording will be available to you this afternoon. Maria's giving me the thumbs up on that. So look for an email from the Cognito team, from me, from you? From me, Jennifer at cognito.com, I guess. And we will send you the slides. I will personally email all hundreds and hundreds of you. We do have automation for that. So that's great. And yes, you will all get the recording, you will all get these slides. So don't make yourselves crazy. Other questions that we have, you're welcome. Other questions that we have, And Rich, you jumped into the frying pan when you mentioned 13 Reasons Why. So I will follow up with, and we are not going to jump down that rabbit hole, but there is one question that I want you to answer. Now that 13 Reasons Why has announced their second season, what to do with developing a suicide prevention policy in light of this and the fact that many teens will view this series?
Yes, okay. So you're right. This is a whole other webinar, that's for sure.
Yeah.
But here are my guidelines. Yes, there's going to be a season 2 because people didn't stop talking about it. And every one of us was interviewed in our communities about it. And to somehow we got away from the fact that this is it's a television show, okay? But as far as guidelines, I have concerns. First of all, I think there are excellent materials from the National Association of School Psychologists and the American Association of Suicidology. So download those handouts that are available. You can see them. They're probably on their main pages now. Provide guidance for how to kind of respond on a local level. My personal feeling is that there's a strong recommendation that vulnerable kids not watch it at all. And I'm a little wary, having survived parenthood myself, in telling kids not to do something. So alternatively, I would suggest to parents that if you are concerned, view it with your child. But I think one thing different today is the ability to stream and to binge watch. I think binge watching, when you watch 13 episodes, one right after another, may drive up the intensity of suicidal thoughts in vulnerable kids. So my recommendation to parents is don't do that. Don't binge watch with your kids, but watch, like the good old days, watch an episode, spend a week talking about it.
Yeah. Absolutely, and I would just jump in and say DeQuincy Lazine from, I believe he's affiliated with AAS, has come out with a booklet where it has a week-by-week talking points for and topics for discussing each episode with your child, and I totally think that is a great way to slow that down. And I don't want to go deep into the 13 Reasons Why land. We do have more questions, and if everybody wants to get back together and have another webinar on 13 Reasons Why, we can do that. And we can also attach to this email the NASP guidelines for talking with kids about 13 Reasons. Operationalizing the task force. We have a number of questions there. You mentioned it, but please do it again. Who should be on the task force? Who should chair the task force? And what percentage of that person's time do you think is required to be part of that task, to lead that task force? Like, is this going to live? The task force going to live forever, all year, and then take the next year to revise the plan? How much effort is involved here?
Well, we put together a task force in LA County, at the county level, and we're like having our 6th annual summit during Suicide Prevention Week. And it has changed members an awful lot, but it is still the movers and shakers in LA County. So I think the short term, I think that you're going to have to meet a few times, certainly over the summer when you can at the beginning of the year while developing your policies. I think in the future the task force meets, only once or twice a week to kind of update, to review the resources in your community. And that's, God forbid, you don't have to meet before then to deal with a crisis in your community, because sadly we are seeing more clusters in communities with the increased suicide rates. So initially, that's why some of these, your task force chairperson, that can be shared. You can have 2. But I'd like to have somebody at the district office, and then I'd like to have your most passionate school-employed, mental health professional be up there as well to help guide the chair in terms of, what the task force, that's why I'm saying that your task force shouldn't be worrying about intervention and postvention. That's for your crisis teams to deal with. The task force should be kind of worried about the policy, and then some guidelines for parent and staff training.
Yeah, great. And what about enforcement? What happens, I mean, you mentioned the liability that school districts open themselves up to for not having policy and procedures if there is a death by suicide, but the question is, who's enforcing that schools have a policy in place, and what happens if they don't have it in time?
Well, that's an excellent question, and I don't answer excellent questions. I just don't know about enforcement of this policy. I think, because I know of no enforcement arm of the Department of Education that's going out. I think if the district shows in the that it is moving in this direction, that's going to be sufficient for the next couple of months. I mean, really, it only came down 8 months ago, and the model policy came out a month ago. So this is all brand new. I know it's creating anxiety out there. Hot hint, calm down, don't rush. Reach out to your school psychologists and counselors and social workers for some guidance if you need it. But just move in a direction of doing this, and be in consultation with your district attorneys as well.
Great idea. Because one thing, I mean, for the dollars and cents folks, we know that if you do have a death by suicide in your district, the cost of that is enormous, right? So, and Rich, I think you have probably some data on this at your fingertips, but what happens in terms of the cost, in terms of staff time, and in terms of the impact on student achievement is powerful.
In the aftermath of a suicide, it's a very complex crisis for a school. And you know the impact when you see the attendance drop, academic scores drop, and discipline and suspensions increase. And that's when you know you're in a full-fledged crisis, and the crisis is not over until you kind of return to the crisis levels of academics and attendance.
Exactly. Okay, so we have a question here. The resource that I mentioned, which is the booklet, is called 13 Answers for 13 Reasons Why. The author is DeQuincy, D-E-Q-U-I-N-C-Y, Lezine, L-E-Z-I-N-E, and I think if you Google that, it will come right up. It does have a cost. It's a download for $6.99, which is more than I bought it for last week at $5. So get them while they're hot. Let's see, what else are we looking at? School nurses. Is there a role? I think we have a school nurse in our webinar. Are there roles for school nurses in this process?
I love school nurses. They definitely, they are critical parts of the crisis teams. And as a matter of fact, many nurses are mental health professionals as well. But nurses have a very complex role today. They are incredibly motivated for staff development, and I've been working down here in Los Angeles with emergency department and pediatric nurses to help link up. And I find all nurses in the emergency department as well as school districts are critical pieces of suicide prevention and very responsive to professional development.
Great. And I think, Rich, we've answered what looks like most of the questions. We've ganged some up. We do thank everybody for their time, and of course you, Rich, for your expertise in going through this with everybody. I know that the model policy came out only in No, no. The model policy came out later than people had hoped in terms of the realities of having it operationalized in September. So it's really, really helpful to have you on the phone and answering questions.
My pleasure.
So I'm going to leave the last word to you. I'm just going to thank you and everybody on the line for joining us, and again assure everybody that we will have the slides and recording out later this afternoon. Fortunately, you're in California and we're in New York, so we have a few hours on you. Rich, take us out.
Well, I just want to say, you know, like here in California, we have two extraordinary suicide prevention efforts through Proposition 63, our Mental Health Services Act. I want to give a shout out to Cal Mesa and their incredible work with statewide projects over the last few years. This is Proposition 63 is our Mental Health Services Act. It made an extraordinary amount of funds available for prevention, and a common thread through all of their funding channels was suicide prevention. I've been proud to be part of the suicide prevention effort in California, and suicide prevention works.
Okay, we're done here. Everybody go back to work. Thank you so much.
All right. Thanks a lot, Jennifer.
Thanks, Rich. Thanks, everybody.